All right, so this is section 4C. It's our automated external defibrillation, adult and pediatric. This is for our AEDs. Any BLS unit will carry an AED with them on the fire side anyways. So it's just pretty much walking you through how to use an AED. Pretty simple, self-explanatory, but we'll walk through it real quick. Indications for this are adult and pediatrics that are unresponsive, apneic, or agonally breathing and pulseless. Your contraindications for this, none. Though futile and obvious death, decapitation, rigor mortis, dependent lividity, and or decomposition. So pretty much any obvious signs of death, you're not going to hook up an AED to them. But besides that, there is no contraindications. So the technique, we use the Physio Control Life Pack 1000. They're very, very simple. Again, once you mess with them once, you'll be fine. You turn on your AED, and it says that or shows that right there in Figure 1. Apply AED, follow illustration for correct defibrillation pad placement. Avoid air spaces, incomplete skin contact under the pads. Avoid placing pads over suspected implanted pacemakers and or implanted defibrillators. C, right here, this is pretty important to remember. If the victim is less than 8 years old or under 25 kilograms, connect the infant-child reduced energy defibrillation electrodes to the AED and proceed to step 3. If infant-child reduced energy defibrillation electrodes are unavailable, place pads in anterior left chest and posterior left chest position when using a standard AED. So again, just one more time, if they're less than 8 years old or under 25 kilograms, that's what you're going to do. The next one is the infants. If they are less than 1 year of age, you're going to manual defibrillation is preferred. You'll follow step 2C if manual defibrillation paramedic is unavailable. And 2C is just what we read right above us. So keep scrolling down here. Step 3, as it's set up here, you'll go to step 3. If cardiac arrest duration is estimated less than 4 minutes or greater than 4 minutes, and without good quality bystander CPR, perform CPR for 2 minutes prior to AED analysis for defibrillation determination. If cardiac arrest duration is estimated less than 4 minutes, immediate AED analysis for defibrillation determination. Follow all AED manufacturer recommendations for safe, effective, and accurate rhythm analysis and defibrillation. Restart chest compressions while the AED is charging. Do not continue to provide chest compressions when the AED is charging and defibrillating. Resuscitate victims of cardiac arrest per applicable protocols, minimizing pauses and chest compressions. So pretty self-explanatory. I think everybody's probably messed with an AED or used one before. Just remember, you're still swapping your chest compressors every 60 seconds. When you do start to analyze the rhythm, you need to make sure that everyone is clear. So verbally say that loudly, make sure everybody can hear you, everybody's clear, and then if the patient needs to be defibrillated, they'll be defibrillated. You'll immediately hop back on compressions. So we're going to hop right into the next one real quick, just because that one was pretty short. And the next one is section 4D. It's manual defibrillation for adult and pediatric. So this is for the Life Pack, which all ALS units will have. The indication for this is going to be ventricular fibrillation, pulseless ventricular tachycardia. Your contraindications are spontaneous pulse, all cardiac rhythms except VFib or pulseless VTAC. Technique for turning on the Life Pack, again, very self-explanatory. We'll power through this real quick. Press power on, connect the therapy electrodes, the defib pads to the therapy cable, and confirm cable connection to the monitor defibrillator. If you look over here in Figure 2, that would be probably the most common mistake, is someone will put the pads on and forget to plug them in right there to the monitor. So if you look on Figure 1, it says lead. If you can't see your rhythm analysis with your pads, you click lead and use your dial and go up to paddles, and it will change it to paddles. Sometimes you do have to do that, so just keep that in mind. Click lead, scroll to paddles, and it should pop right up. Prepare the patient's skin and apply therapy electrodes to the patient in anterior left chest and posterior left chest position, just like we talked about earlier. We're not doing how We've done it for a while. We're going to do this, and then when you get that second cardiac monitor on scene, which we'll talk about here in a later protocol, we'll put 4 pads on. So confirm desired energy selected, or press energy select and rotate the speed dial to the selected desired energy. Rather that be 200, 300, 360. We'll talk exactly when you or how much you charge that to defibrillate your patient later on. Sorry. Number 5, press charge while the monitor defibrillator is charging. A charging bar appears and a ramping tone sounds indicating the charging energy level. When the monitor defibrillator is fully charged, the screen displays available energy. Again, over here in Figure 5, Figure 6, Figure 7, it shows exactly what buttons you're pushing and how you're doing it. Make certain all personnel, including the operator of the monitor, are physically clear of the patient, stretcher, bed, and any equipment connected to the patient. That's what we talked about with the AED, just making sure everybody's clear and nobody has any contact with the patient or anywhere near the patient. Confirm ECG rhythm of VFib or pulseless VTAC. Confirm your available energy, and then press the lightning bolt. It's the shock button. So you'll press the shock button on the monitor defibrillator to defibrillate the patient. An important note here, if you need to cancel the charge, you charge it up. We're always going to charge them or charge the monitors while we're doing chest compressions, and then you read your rhythm analysis and it's a systole or PEA or whatever the case is, they've obtained ROSC and you need to disarm and cancel the charge. You press the speed dial. So that speed dial at the very bottom right-hand corner, you just press it and it will dump the charge. The monitor defibrillator disarms automatically if shock buttons are not pressed within 60 seconds or if the energy selection is pressed after the charge begins. If defibrillation is not indicated upon a rhythm check, disarm the charge before resuming chest compressions to prevent inadvertent electrical exposure to EMS personnel. So yes, we want to hop right back on the chest right when the rhythm analysis is done. If it's applicable, you haven't obtained ROSC, but make sure whoever is in charge of the monitor dumps that charge before you hop back on the chest. And then repeat procedure starting from step 4 when indicated. So for pediatric patients, if a patient's less than 4 years of age or under 15 kilograms in weight, connect the quick combo pediatric electrodes to the monitor defibrillator and proceed to step 3. Initial defibrillation for pediatrics is 2 joules per kg, with the second and subsequent defibrillations at 4 joules per kg. Prior to determining manual defibrillation settings, count prior AED defibrillations. Down here at the very bottom, defibrillation clinical pearls. In an emergency resuscitation setting that requires defibrillation, if unfamiliar with monitor defibrillator available, look for the 1, 2, 3 sequence that all monitors are labeled with industry practice. Turn on a device, select energy, charge device. Typically immediately next 3 is the shock or discharge button. Talked about that. And we talked about that. So it's highlighted at the bottom, so I'll say it out loud just so everybody hears it. Do not continue to provide chest compressions when the monitor defibrillator is discharging or defibrillating. So pretty simple stuff. I think most people have probably worked with a life pack. If you haven't and you've worked with the Zoll, it's very easy. It's kind of similar. It's just the buttons are in different places, and it does have a little bit, or the Zolls have different features than the life packs and vice versa. So make sure you practice with these, especially if you haven't used them. If you have any questions, again, feel free to ask. And that's where we'll end on